Most of my focus today is going to be on things you can do in your OHTs to self-serve getting some of these forms of evidence. But I do also point to the fact that, evidence support of the types that Justin, Diana, and John mentioned that Walter provides, among others in the province, are absolutely essential. But I hope that the big picture that I'm providing about different sources of evidence and some of the steps and prompts that you can take internally will help you and your group and your OHT kind of advance your work using best evidence as needed. And then reaching out to groups like RISE or like OHRI or Craner or HSPN when you can't find what you need to get, and you do need to engage folks who can provide you with, as Walter described it, the intro, new flows of evidence. So I think this is pretty clear to everyone. Justin really helpfully at the end of his presentation mentioned how evidence synthesis and support really is a separate gear that we need to be focusing on, but transects all of the others. And importantly, we need to be considering the use of evidence and improvement cycles more generally, whether we're focused on the Big Bang reform decisions, such as introduction of OHTs, but all of the 1,001 organizational program decisions that you and your groups need to be making. So evidence synthesis and support, I'll take a deep dive here. And again, as I mentioned, I'm going to really be hopefully focusing on some of what I would call self-serve stuff. But why is this gear important more generally in the context of the work that we're doing? It's just really helpful to be able to pull on existing evidence and rapid evidence syntheses from groups that are able to provide those to help you get a sense of what has worked, what hasn't elsewhere, what are the key components of those things that worked, when can they be adapted, or where do they have to absolutely stay in place, what conditions are key, what context matters most, and what barriers are identified when you're thinking through either a program that you're thinking of implementing, a particular clinical pathway, et cetera. So all of these things can be informed by existing evidence. So what are the benefits of things like evidence synthesis? I'm going to get into many different forms of evidence today in a second, but evidence synthesis specifically versus a single study. So I know that for those who have taken methods courses, you'll know this already, but I think it's worth reminding ourselves that an evidence synthesis ideally is a summary of what's been learned about a particular question you have from all of the studies conducted around the world on that particular question, including, when they're really well done, how this might vary by groups and contexts. And this is very different than what can be learned from a single study conducted with a single population in a single health system or region or a community. Those can be helpful as well to help you contextualize global findings, but there are some benefits to those kind of big picture global evidence syntheses. So they're likely to lead you in the right direction. So frame negatively, less likely to be misled by the results of a single study. If you're relying on evidence syntheses, it can increase your confidence that something is going to work, particularly when you have an evidence synthesis, say, includes 100 different studies, all showing the same findings. If you know that things have worked the same and the results have been the same across 100 studies over time and in many different settings for many different groups, your confidence can increase dramatically at the ability of that particular intervention, program, clinical program. Anything you're thinking of will work across different contexts. Essentially, if you're looking at questions of effectiveness, so does something work? Does a program work? Does this clinical pathway or this approach to implementing a clinical pathway work? You can get more precise estimates of whether something works with a well-conducted evidence synthesis, particularly when there are many studies included. Really importantly, I don't think anyone else mentioned this, but given we know that context, issues and evidence evolve over time, increasingly we're seeing folks like Justin's group, others doing what we're calling living evidence synthesis. So regularly updating an evidence synthesis, making it publicly available. Often these are powered by artificial intelligence and machine learning. And this can help you stay abreast of any new evidence that comes out. So during COVID, this was absolutely essential as the evidence base was shifting sometimes hourly. So really important thing to note there. So what do we mean by evidence synthesis and support? So I've already mentioned it a little bit, but when we talk about evidence synthesis, it's really two things. And I think Walter said this really succinctly. You can either pull on existing evidence syntheses that exist or engage groups like Justin's, Diana and John's, Walter's, mine, to do new rapid evidence syntheses on questions you might be looking for. So you can be pulling on the global evidence base or asking for a contextualized evidence synthesis. All of these approaches really, though, are pulling on all the best studies in the world on a particular question you might have. I've already mentioned it's a key input into Gear 3. Really, when you're co-designing, Justin mentioned this as well, but it's really important among all the other gears as well. And I'll get into that in a second, as I will show on the next slide as well. Other forms of evidence, we've heard about many of them today, are really important at different points in the learning and improvement cycle, and we'll talk about that in a second. But again, the focus for the next little bit is going to be on prompts that I hope will make your life easier when you're thinking through, how do I actually reach into the research world, pull out the best evidence syntheses in ways that are simple and hopefully not creating too much of a burden on my team. So you can see here, I'll start with the fact that evidence syntheses can be done of any of the types of evidence or research that I've listed here on the screen. But just to note that there are many different types of evidence that can inform your decision-making as part of learning and improvement. So you might just be at the beginning stage, which was discussed during the last webinar, of, what are the system gaps and what's driving them? What are the inequities that my OHT is facing? What priorities are addressing? So here's where you would look to things like data analytics, modeling, and qualitative insights to try and get insights about how to approach Gear 1. Of course, as I've already said a couple of times, you can also get evidence syntheses of all of these types of studies as well. In Gear 3, when you're doing co-design, of course, you'd be drawing on evaluations of similar interventions that you're considering or programs that you're considering to see if it's worked and how it's worked. Modeling studies can help you predict what might happen when you pull a particular lever, introduce a program. Qualitative insights can also help you understand how different stakeholder groups might perceive an approach you're thinking about. And of course, you can also have evidence syntheses of all of these types of studies as well from around the globe. You might also be looking here to health technology assessments, cost effectiveness analyses, and guidelines to provide you with direct recommendations about what you ought to do to address a particular problem. When you're implementing, evaluating, taking feedback and adapting in real time, which would be Gear 4 and 5, you'd be drawing on many different types of evidence as well. So behavioral and implementation research with groups like Justin, qualitative insights that many of the folks on the call today spoke about, of course, evidence syntheses of all these above. And as Walter mentioned earlier, this process in and of itself should be considered an opportunity to create new flows of evidence. So you'd be doing data analytics in real time, evaluating your approaches as you're implementing them in your OHT, and contributing to the knowledge base that other groups in your OHT or other OHTs across the province can be leveraging to advance their own priorities. So here's the quick and I hope clean enough prompt list that I think will help you and your teams be systematic and transparent in a relatively easy way when you're looking to draw on existing evidence syntheses in your work. So as I've already mentioned, it can be important in many different stages of the learning and improvement cycle. And here are the 5 prompts, which I'll get into each in turn. It's important to keep in mind that the evidence support kind of infrastructure in the province has moved very, very rapidly and changed a lot since, I would say, the last 3 years. So learning from COVID and trying to put in place those things that can help folks leverage evidence when it's needed. And ideally, these can help you do your work more efficiently. So the fact that we do have groups like Diana and John's at Craner, Justin at OHRI and HSPN, is just a real boon to our ability to leverage best evidence in our work and have greater confidence in how we're moving forward. And also something I think it's important to note that it is easy for people outside your organization to assess documents that it puts in the public domain. So consider whether or not you're using some of these prompts and taking these into consideration when your group is publishing something. Trying to be systematic and transparent will give others the confidence that they can draw on your insights from your OHT and implement it in their own setting. Thinking through that Ontario has a range of folks available to provide you with evidence support. Many of them we've spoken about today, we've heard from, and others you'll see there like Inspire, Rise Nosm for those working in the north, HSPN, of course, I would say RABE as well at the Ministry of Health, and I see Jeffrey on the line today. All of these are types of groups around the province who can provide you with evidence support in a timely, demand-driven way, and they're linked to support decision-making up to advisory and decision-making processes as well as out to learning and improvement platforms. So this is our best take at trying to organize all of the groups across the province that can provide this type of support by type of evidence that I mentioned. But note that as we've seen in the presentations today, there are many areas of overlap here. So it's not as though just because we're written into one area, it means that that's all we can do. Well, here are the links to the 4, I think, key databases that if you and your OHT are working on trying to pull in best evidence from evidence syntheses, here is where you would go for the different types of questions. So again, access for clinical programs and services, health evidence for public health programs and services, health systems evidence for health systems questions, and social systems evidence for things outside of health. And these are all free public resources for you to use. I don't think it's that weird. McMaster is known for evidence stuff. So all of these databases are run by different groups. We're not always, working together, but we coordinate when we can on these. But these are all based out of McMaster because we think, having access to free, quality appraised evidence syntheses is a great way to help you increase the likelihood that you'll use best available evidence and evidence syntheses when you can.